Hi, my name is Valerie Lohman, and I'm the Regional Director of Specialty Services for Marquis. Today, I have the privilege to sit with Dr. Wu, who is our full-time physiatrist at Seacrest Village and Rehab. Hi, Dr. Wu.
Hi, Valerie. Thank you for having me.
First of all, I want to thank you for coming. I know you're very busy, and all these wonderful services we have here at Seacrest. But can you do me a favor? Can you let everybody know what is a physiatrist?
Well, sure. Well, I'm a board-certified physiatrist or physiatrist. You could say it either way. I am a physician specialist, such as a surgeon or an orthopedist or neurologist. I specialize in physical medicine and rehabilitation. And I work closely with the physical therapist, the occupational therapist, and speech therapist. And together we work as a team to help maximize function in many of the patients, such as in mobility, which is walking or transferring, in activities of daily living, which is feeding, dressing, toileting, and also in speech and swallow or cognition and memory. As a physiatrist, I work with certain patients which are mostly chronic illness or disorders, such as arthritis or musculoskeletal disorders, back pain. I work with neurology patients, such as patients who've had strokes, multiple sclerosis, Parkinson, and also orthopedic patients, those patients who have had recent hip or knee fractures or also joint replacements.
So those are all the benefits that your services provide the team here.
Yes.
Very good. Can you give us a little bit of a background as to some modalities that the team does here to bring that level of care?
As a physiatrist and working with the rehab team, I play several roles. The benefits of my care here is that I focus on the medical care of the patient once they start rehabilitation and start exercising. As you know, most of our patients come from the hospital, either being treated for illness or recent surgery. They are very deconditioned and weak. They have often been on bed rest for weeks or days, many days, and sometimes weeks. And so they come to us very debilitated. So we start them in physical medicine, we start them in physical therapy and exercise, and sometimes they have medical issues such as their heart rate or their blood pressure dropping. They may feel lightheaded, dizzy, or nauseous. Their legs may swell up. So I'm involved in, trying to assess what their problem is with exercise and also modifying their medications or using adaptive equipment such as abdominal binders or pressurized stockings or sometimes elevation of the legs. In the therapy, sometimes patients complain of increased pain due to their arthritis or their joint pain, and sometimes their medications need to be adjusted or modalities need to be implemented, such as heat or moist heat, ice, TENS unit, ultrasound, some of the modalities that therapy can use that are very beneficial for patients. For some of our patients who have respiratory or pulmonary issues, we need to assess how well they do with exercise. Some of them are on oxygen and they get increasingly shorter breath with exertion. So sometimes their pulmonary medications or oxygen need to be titrated and adjusted. For those patients who are newly on oxygen, we try our best to get them off the oxygen before they're discharged, so we're monitoring and assessing their oxygenation with pulse oximetries and testing them with and without exercise and with and without oxygen. For patients who have contractures or drop foot, I am available to assess for possible bracing or orthotics. For the patients who have amputations, you need to assess their wound first to make sure that it is viable and appropriate for a new temporary pylon or prosthesis. And I order the prosthesis according to their age and their weight and their activity level. Also for discharge planning, I can be involved with the families and the staff to find the most appropriate discharge setting that is safe for the patient. With a social worker and the family, we discuss, whether the best option is for long-term care versus assisted living or versus home with 24-hour care or just several, at home aid several hours a day.
Well, first of all, I want to thank you again, for taking the time to sit with us today. You know, Seacrest brings a lot to the community, and one of the things that we like to say is that the care starts here, but it continues outside. So with that said, I want to thank you with the therapy team and along with all the nursing staff here at Seacrest for coming in today.
Oh, well, thank you. It's my pleasure.